Okay, I'm here today with one of my patients who was kind enough to do this little short video. We're doing a follow-up visit for him today, and I thought that it would be interesting for him to share his success story with us because it is pretty remarkable. And he's 52 years old now, right?
Yes.
And when he first presented here, it was just turning 50, I guess, right?
Right before 50.
Right before 50.
No, I was 50.
So you've been here just about 2 years, slightly over 2 years, and you presented to this office. What was going on, and what was the reason why you presented?
I was feeling exhaustion and tiredness and just not being able to get out of bed some days.
Yes, yes. And how about your weight? What was your weight like?
I was about 188, 189.
And body fat was about what?
34%.
34%. And we did that with the body comp machine, so we have hard data to show your progress. And when we did your blood work, we also found that you were pre-diabetic, right?
Yes.
6.1 was your diabetic marker, yeah. And your cholesterol markers were also high, and you were on a cholesterol drug at the time, right?
Cholesterol medicine.
Yep.
It was probably about in the high 200s, the cholesterol.
Yes. And we put you on a program to help decrease your body fat using some hormones like testosterone, DHEA, thyroid. And you've seen a lot of benefits in that inside and outside the bedroom, right?
Yes.
So just to tell the audience, your body fat today is 19% body fat. 19% down from 34%. That's a significant difference. You must be working out hard at the gym.
I don't work out at all.
Nothing at all? Zero?
Nope.
So,
I just walk at work a little bit.
And you've always walked at work, right?
Yes.
I mean, this is nothing different. Walking at work is normal for you, right?
Yes.
So you basically lost almost half your body fat just by doing our program and not working out at all. And are you still on cholesterol medicine, or are you off that?
No.
Totally off it.
I went off it as soon as I started coming here.
Great, great. And you're seeing some improvements in the bedroom as well?
Yes.
Enhancement in the quality of your erection?
Yes, and stamina.
Stamina and lasting a little
longer.
Good, good, good. So your wife's happy.
I don't feel like I'm 15.
You don't feel like you're what?
15. Where it's over real quick.
Yeah, I hear you. I hear you. You must be experiencing a lot of side effects from all these hormones, right?
Just good numbers.
The side effects must be good side effects, right?
Yeah.
Would you recommend this to your friends?
Absolutely.
All right. And how's the quality of the staff in the office, and how are you treated?
Great.
Good, good. Is the doctor always available for you?
Absolutely. He's on speed dial.
All right. Well, thank you very much for doing this little short video. I thought it was important just to share with a lot of other people who may be interested in our services. And we'll update them once you start working out with Arnold.
Thank you.